this is a very exciting and a growing field. And as the field gets expanded by discovery of newer antibodies, their utilization in clinical practice, growing understanding of how these disorders are caused through antibodies, T cells, and then the role of chemokines, cytokines. And also as our arsenal of immunotherapies grows, it's getting more and more complex. That sort of highlights the importance of dedicated clinical training to practice as an autoimmune neurologist. And the importance of the training is not just the clinical arm, not just seeing patients and understanding how to diagnose and manage your patients. I think a very important aspect of the training is also understanding the importance of how the antibody and other tests are being performed and their limitation. So a good example is the fellowship, which sort of I did here at Mayo Clinic, where we have 50% of the time dedicated to clinical practice, seeing patients, managing patients, but the remaining time we spend in the clinical lab, understanding how these antibodies firstly are discovered, how they are validated, how they're being tested in clinical practice, what are the limitations of one test versus another test, which test to go for if your antibody test result comes back positive, but the clinical scenario is not consistent with that antibody test results. What are the factors we need to think about as far as the antibody result is concerned? So I think the combination, having that clinical arm, also that translational arm, is crucial as a part of the training to become an autoimmune neurologist.